A healthy economy with an unhealthy habit that costs China $5 billion a year. 350 million smokers light up across China every day, and the market is being saturated by row upon row of brands. China is the world's biggest consumer of cigarettes, and economic growth here is accompanied by parallel growth in lung cancer and stroke rates, with cigarette marketing aimed at duping smokers into buying so-called low-tar cigarettes. These low-tar cigarettes are just as deadly.
I started smoking at 19 years old. Now I'd like to stop, but I can't. Now it's an addiction. I need to smoke.
On the hospital wards, doctors are playing a unique role by supporting patients wanting to quit and also leading by example.
Medical professionals have been encouraged for tobacco cessation for themselves and also for the patients they are taking care of.
In Africa, the smoking epidemic may not appear as threatening compared to China, but recent data shows storm clouds are on the horizon. Almost 1 in 10 young Africans aged between 13 and 15 years old is a smoker. Rapid population growth combined with forecasts of economic growth is making Africa the perfect target for tobacco companies. At the World Health Assembly in Geneva, ministers of health are agreeing on a strategy that will further tighten the screws on the tobacco industry.
The challenge is to get our governments to put in place those tobacco control policies that are proven to be cost-effective in preventing and reducing tobacco use.
The World Health Organization is collaborating with governments and partners to help them strengthen legislation through an international treaty created in 2003 and ratified by 154 countries, including China and 35 African countries. WHO and partners are also bolstering this treaty through a tobacco control roadmap. Branded as Empower, it's designed to help addicts quit and prevent young people from starting. It also protects people from second-hand smoke.
What is urgently needed is political will for policies such as high tax increases, complete bans on advertising, and 100% smoke-free environments.
The real concern is that Africa could begin to match China in terms of cigarette consumption if a core set of tobacco control measures are not put in place. In China, tobacco already costs the economy $5 billion a year. But for Africa, where economies and health systems are far more fragile, the burden of the tobacco epidemic in terms of death and disease could be far greater.